Happening nationwide and right here in Lincoln, the overuse of antibiotics is leading to superbugs impacting the treatment of bacterial infections.
Yeah, just last week, experts on antibiotic resistance urged Congress to pass legislation that would address the issue. Channel 8's Danielle Kaiser joins us now live with those details. Good morning, Danielle.
That's right, Andrew and Katrina. Superbugs, as the medical director of infection prevention at Bryan Health said, is a generic term referring to difficult to treat bacteria, and now we're seeing an escalation. The reemergence of these superbugs means longer hospital stays and more expenses for the person visiting with the bacterial infection. Director of Medical Prevention, Dr. Jim Nora at Bryan Health says the outcome will vary by patient.
Now, instead of getting a single antibiotic to treat their infection, they might be getting 2 or 3. They might be getting antibiotics that have significantly more toxicity. Those particular patients, it would be very unlikely that they would be able to just discharge on an oral antibiotic. Probably they would have to stay on IVs for the entire treatment course. So it's going to be a longer hospital stay, more expense, and more toxicity for those patients.
This is in comparison to the patient able to be easily treated with oral antibiotics for a non-resistant organism. He says this poses a challenge for states like Nebraska because research done agriculturally can also be affected by the overuse of antibiotics.
At the same time, we want to have alternative strategies in place for minimizing antibiotic use not only among humans but among animals and livestock as well.
Nora says the solution is to use less antibiotics and only use them when necessary.
Antibiotic use is the primary driving factor for for the emergence of some of these resistant organisms. So I would really encourage patients and encourage all healthcare providers to really think twice about whether we absolutely need to use an antibiotic.
The Pasture Act, introduced by the U.S. Senate panel to Congress, has the ability to control the issue of antibiotics and, if passed, would establish a criteria within health care. Nora noting it potentially benefits the field greatly. Reporting here in Lincoln, I'm Danielle Kaiser, Channel 8 News.
Thank you very much, Danielle.